You're probably wondering why a video about me getting a hair transplant would be relevant to you. This is predominantly a sim racing, tech, gaming, review channel, good time, live streaming, doodah, what's it, whatever you have. So more than likely you are indeed a sim racer. If you're not, welcome. So I know that my audience is predominantly male, with 99% of you more than likely carrying an XY chromosome. Now, I also know that my age demographic sits somewhere between the ages of 12 to 65 plus, with most of you being between the ages of 25 to 55, with the peak being somewhere between 35 to 45. Bear with me. Now, we know from data released by the National Institute of Clinical Excellence that 80% of men at some point during their lifetime will experience some form of male pattern hair loss, which by extrapolation would mean 80% of my community would also be experiencing some form of male pattern hair loss, and by further extrapolation, the sim racing community at large being, let's face it, more than likely predominantly male. Now, we also know that male pattern hair loss can start anywhere from between the ages of 20 to 25, and as we get older and older and older, it just gets worse and worse and worse, and that can have a knock-on effect with things like self-esteem, mental health, and just generally not feeling very good about yourself. The most important thing for me when I started this YouTube channel was to be authentic, because I think if you start displaying an element of yourself that is inauthentic, particularly to an audience, I think you guys are intelligent and I think you would pick up on that. I am a trauma and orthopedic surgeon, and I also run a YouTube channel, which makes me, I guess, a content creator, which by definition means that I am putting myself on camera and exposing myself to the world, being that you guys or anybody who chooses to click on this video. Now, this is something particularly, getting a hair transplant I've been apprehensive about, and, at one point or another, maybe a little bit embarrassed about, or I didn't wish to speak about it, or I was in denial about it. Now, I was hoping that most would say, like, from the front, Scott, you look pretty good. What are you talking about? But I am indeed thinning on the top, and it's been something that's been going on for a little bit of a while, and it's something that bothers me. And I've decided to take the plunge and deal with it. So I had three options available to me. Either I could bury myself in a hole and I'd have to become a faceless YouTube channel for the next 6 months, 7 months while my hair grew back. And that really wasn't an option because I like the face-to-face dialogue I have with you guys, and I feel it's very important and I would miss that. Option two is you go the slightly ridiculous route and start wearing lots of hats and trying to hide the fact that you've shaved your head and had somebody stab a load of holes into it and move some follicles around. And that wouldn't have been very good because then people would have picked up on it. And also, it's a bit disingenuous, and the whole point about this is being transparent and honest. Then the third option is just to talk about it and use it as a tool to spread awareness, because let's face it, this affects a lot of men, and if you're like me, we don't like it. It's not a comfortable thing to have happen. It's a sign that we're perhaps getting a little bit older. It can lead to a loss of confidence, perhaps, a lack of self-esteem. And hopefully by talking about it, it might encourage maybe some other people to talk about it, that it's not that much of a big deal at all. And, it's just one of those things that happens. And there are avenues to deal with it if you so choose. So here we are. So let me be clear. No one is dying here, right? Hair loss is hair loss, and it's not going to kill anybody. It's not a nice thing to have happen, but it's certainly not a horrific disease or something. And I'm not saying that bald looks bad. In fact, there are many, many men where bald looks absolutely fantastic. Bald is beautiful, brave to shave, etc., etc. However, for some men, me included, I don't particularly want to go that route just yet. And I like having hair, and, I want to keep it. Touch wood, that's the whole reason why we're doing this. So then starts the journey of, you may try things such as caffeinated shampoos to try and boost the circulation in your head. Or, there was the famous COVID-19 ponytail, of which I wore to work for a year, of which I thought I looked pretty cool, but probably never to be repeated again. Then there's also things such as maybe you decide to take the plunge and try some actual medication. And in my case, I tried topical minoxidil, which is supposed to, boost a bit of hair growth on the top. And, I applied that religiously for probably a course about 2 years, doing it in the morning, doing it in the afternoon. And it becomes exhausting. And then it also gets to the point where, you're there in front of the mirror and, you got the mirror out and, you're styling your hair in a certain way to make sure that you look your best as possible. And it just gets exhausting. And it just got to the point where I was tired of dealing with it. And I'm fortunate enough to be in a position where, I have an avenue within, the United Kingdom where we have options available now where we can do something about it in the form of a hair transplant, and that's what we're going to do. So what happens now, I hear you ask? Well, as of the 6th of November 2024, put the date in your diaries, I will be getting my hair transplant procedure whereby I will have to shave off all of my locks and suck it up, for lack of a better word. So what I am having is something called a follicular unit excision, whereby individual follicles will be excised and taken from good parts of my head, the donor area, and placed into the area that needs it, being the crown on the top of my head, so the grafting area. The whole procedure should take somewhere between 6 to 8 hours. It's completed over the course of one day. It's all under local anesthetic, and it might be a little bit painful, although, steps will be made to make me as comfortable as possible. Big question is, where am I having this done? And I know there's a lot of popularity in the media at the moment with regards going over to Turkey, Turkish holidays, etc., etc. Now, I'm going to emphasize this is my experience as a patient. I have no experience with hair transplant surgery. I have never done it myself. All of my experience has been within the NHS, and I've done general surgery, plastic surgery, vascular surgery, orthopedic surgery, and I think a bit of breast surgery. But I've never done any hair transplant surgery. So I did a lot of research, and I found this gentleman called Dr. Ted Milne. He has a hair transplant practice based in the United Kingdom. And what was also quite nice for me is that he was trained at the same medical school that I was, which was the University of Bristol. So not a massive thing, but for me, that sort of, pushed him over the edge. And I thought, you know what, this seems like a very good fit. So I'm going to be documenting my journey along the way, in addition to all of the other content that appears on traumateamracing. And two very important things. I've spoken to Dr. Ted Milne, and he has agreed to come on the channel and do an interview just giving his philosophy on hair transplant procedures, how he approaches it, and, we'll have a little bit of a discussion about how it affects men going through the same thing. And secondly, we're going to record the surgery. Yep, we're going to do it. Anyway, if you want to follow along, click like, subscribe, all that good stuff, and I'll see you, in the next video. Bye for now.